Hello, my name is Surprise.
Craig.
Today we'll be reacting to some videos. This is Hills Reacts.
Like making up names for the show as we go. We're reacting to videos. Sounds like that bird. What's that bird again? That
Oh,
just
woodpecker.
a woodpecker. Oh yeah. Oh, those are some strong teeth.
Those are some strong teeth.
Mm.
Those are some
And look at those marks. It looks like he's been doing it a while.
strong. But he must have signs of wear.
Yeah, definitely.
You can't.
Yeah, did you know squirrels also always have to eat like nuts so they can keep their teeth short because their teeth never stop growing. So when they stop
Oh,
doing that, they can even grow to like abnormal lengths and they can't function anymore.
it reminds me of like another fact, like how they see ancient human diets is by looking at the wear patterns on the teeth.
Mm.
So they can see, oh, this is a grain heavy diet, this is a meat heavy diet because of all the wear patterns. And seeds, create a certain wear pattern. But what?
What about it, Danone?
Oh. So there's an interesting thing, right? Word on the streets is that people's jaws are getting smaller because airway and limited chewing. So that's why there's more crowding and less wisdom teeth. That's what the word on the street is. I don't know. And they say it's affecting people's airways, clavicular stuff,
Mm.
But anyway, the caption says patients testing your restorations. So what that means is when you put fillings or even crowns, they're not like your natural teeth. So they do have like certain
Yeah, we're like, hey, watch your diet.
yeah.
Don't bite apples with those teeth.
Yeah, because
Yeah.
they're not like your natural teeth, so they can fracture those crowns, posts, and stuff. So, yeah. But whoever did his fillings, did a great job.
I don't think it's. I don't know if this is cultural, like if they have to shape their teeth a certain way, or it's just this particular individual. But
So apparently people in this truthfully do say they do those, they do that act for medicinal purposes.
Oh.
Started buying
Oh, wow. Okay.
tools couldn't work.
No, in that it makes sense. Like it goes through your teeth, it goes through your mouth. Again,
Yeah,
but it's a good video.
I like the sound.
I like the sound too.
Whenever you think you've seen it all, the patient tells me they broke their jaw when they were a kid, which is like 50 years ago, or maybe 60 years ago. And you look at the CT scan, you realize, they're missing one of their joints. Look at that. Never was replaced, never was fixed. No pain at all. Patient has no clue that they cut out her joint and never gave it back to her. That's interesting. Now what do? She's 75 plus years old. She opens crooked, has no pain, and needs some upper and lower teeth. What you gonna do? The fun of dentistry. As I say, the cases are getting harder and harder and harder.
The cases are getting harder and harder and harder. I could resonate with that.
Mm-hmm.
Struck a nerve.
Yikes. I guess like for treatment, it can get like pretty weird, especially if the patient needs teeth for chewing and they
Yeah.
have to get prosthesis. But like otherwise, I'd be like, wait, you survived for 50 years. We don't
Yeah.
have to give you another one. And at 75, I don't think any like
Because she
So-
probably opens her.
yeah. Yeah.
So basically, like this part of the, what do you call it? Is the condyle.
Mm-hmm.
Condyle of the
Gone.
of the mandible is gone. So it looks like, and it happens in accidents. Sometimes, things fracture. Why didn't put a prosthesis? Why didn't replace it? She's 70 years old. Medical technology, 60 years
But
ago.
75. I guess
Yeah,
she was 25 when it happened, yeah?
Didn't they say kid or something?
I thought they said 50 years ago. It happened.
50.
Yeah.
So like
she was about 25 there.
10, 5. That's like 1970. I don't know what surgery was like back then. So probably had limited options. But what do you do? I don't know. Send to a specialist. Send to a specialist.
True. But I think like there's probably something fixed we'll
Mm.
have to do because I don't think a normal denture there would be stable, especially with that type of awkward movement.
Yeah, because when you do a denture, one of the things you have to do is called jaw relation. So you have to take blocks of wax or whatever instrument, and you have to try replicate the bite, which is comfortable, right? Because when you bite, your condyles move in a certain direction. So you have to get something which is very almost where your normal condyles would be if you had to have teeth. So it's a quite a difficult thing to do. Very difficult to do with this because how are you gonna do it if you keep getting like a very varying bite? Because the thing is, it has to be the same. So you have to repeat it like 4 times and say bite, bite.
Yeah.
And then that's why we even ask like say Emma, say Mississippi, because you want to test the bite, you want to test if there's enough space. So with this, yeah.
Right? Talk about unhinged.
You're so funny. So that was a good video.
Yeah, like I would like to see how they did it.
Yeah, that would be cool.
Fascinating.
Doctor, okay, I'll check it out.
How are you doing today? All right. Just gonna take a look inside. Looks like there's something stuck in here.
What is that a horror movie?
I love comic relief.
I do dentist what's I've never had a nightmare like that.
The teeth don't just appear out of nowhere.
Yeah, like probably like a lawsuit is my worst nightmare.
Yeah, but this
But
not
that is
no.
that like an alien or a zombie?
What movie is this? Yeah, but nothing happens like that. Okay, so if you're a kid and you're watching this and you want to study dentistry, don't worry, we don't have these problems. You know,
Have you ever been bitten before? Just no.
bitten.
Never
Mm.
smitten.
No, by a kid. Yeah, kids are the ones who bite. Kids are lethal. Yeah, especially.
Really?
Yeah. Like last week, we had a kid. She was biting the parent. That, yeah.
But do you get bitten?
No, but like, you will get like nicked by a kid. Like yeah.
No.
Kids are like
I get licks.
licks.
Mm.
Oh,
It's not kids.
next one, crazy.
My name is Indy Woods. I'm from Brussels and I tattoo mouths. The process is we clean the area, I draw the design on and then I hand poke them. It should hold forever. It depends a lot on the acidity level. The inside of the mouth is pretty wet. It's kind of difficult to get inside or to see what you're doing. There's definitely a strain on the jaw or people want to swallow, but I'm not really going full dentist and using tools. I'm grateful that people trust me with their body, whether it's the inside of a mouth. My name is Indy.
So that's cool.
That's cool.
Yeah, I think out of all the weird side tattoos, like this is like not one of the worst ones. Like eyeball tattoos, those scare me. But this, well, it's socially weird, but I don't think it has any
No,
consequences,
doesn't have any negative. In fact, the tongue ring does more
damage than a mouth, like than a gum tattoo or a
Yeah.
palate tattoo. And then they'll tell you like, no, don't inject me. I'm afraid of injections. People are getting tattoos in their mouths. You can take one injection. You know.
All the tongue tattoos.
It's just staining.
Oh,
It's just
yeah,
like
it's just
yeah,
it's a tat.
it's a tat, I guess.
Yeah, it's not unhygienic. It's
Yeah.
not gonna cause any damage. It's just,
It's so funny how people
your in-laws will judge you.
have brown gums and want to make them pink, and people who have pink gums want to make them black. Yeah, you know these people who come like saying, I don't like my gums, they too brown, too black, and then you do laser to remove that. But then the guys are like, make them black. That's cool. But this is fine,
Yeah.
do you,
It's not hazardous.
whatever gives you,
Mm.
that happiness, your sense of expression, go for it, man. Go for it. He's using gloves.
Mhm.
Looks like he sterilizes his instruments and he's got PPE on.
Mhm.
So what can we say? It's all good. It's all
Mhm.
good. See.
Here's why you should never trust your dentist. This devil right here is dentist Harold Schneider. He's famous for pulling out way more teeth than needed. He's worked on thousands of children and puts them in a straitjacket while they scream for their lives. This guy has literally choked children and laughed while doing it.
He choked me.
Some moms were so mad they showed up at his house to fight him, but all his charges were dropped because apparently he has a mental condition, and said he did all this because the government was paying for each tooth pulled. Why you should never trust your dentist. This devil right here is dentist Harold Schneider.
I don't know if that's why you should never trust your dentist. You shouldn't trust that dentist. We don't do that exactly like
Yeah,
that.
I've got no straight jackets, man.
Yeah. We used to sit on kids in government.
Yeah.
Hold them down.
Hold it down.
Yeah.
Grab the tooth.
Is this how you raise the baby? But interesting dude.
Interesting.
I wonder
dude.
why just kids,
Mm. I wonder. Interesting decision. Life decisions.
But
yeah.
again, mentally ill,
Yeah, he's got a mental condition.
right?
But not all dentists do this, right?
Yeah.
So
So that's not why you should never trust your dentist. Hey, that is fascinating. I've never heard of
I've
this.
never heard of this. I like the guy who's presenting the
It's like
hyperbole.
hyperbole. Yeah,
That's just why you should never trust your dentist. Like, what do you
you
mean?
should go see a dentist. I'm just kidding. That was unnecessary. That was unnecessary.
Guess who just left the dentist? Y'all see that? Stop playing. Look at that blame. New choppers, they big, huh? Real big. But so is the check, so I'm going to smile anyway. I can't close my mouth right.
Is this a filter? Is this real?
Let me see that again.
Guess who just left the dentist? Y'all see that? Stop playing. Look at that blame. New choppers, they big, huh? Real big. But so is the check, so I'm going to smile anyway. I can't close my mouth right.
Something
Guess who just left the
you
dentist?
buy on Temu or something. It can't be, those can't be real teeth.
Right?
Yeah, I know dentists can sometimes do like not
'Cause
the
it's
best
the
work.
gums though that
Yeah.
are giving it away.
I don't think it's real.
Yeah.
It could be like something you put on top of your teeth.
Mm-hmm.
I don't know if it doesn't look like real teeth, Yeah, even the gums and everything doesn't look real.
Mm.
Yeah, if it's real, shout out.
That was like a horse neigh, but I don't know how we do that. But if those are her real teeth, no, I'm just horsing around. No, I don't think it's real. It looks like one of those Halloween toys.
Yeah, it does.
Mm.
It does. I mean, the way the gums are, and like I said, even if a dentist does bad work, like there's degrees. Like you can see, okay, this how bad, but this I don't think any dentist like, oh, I did this. Go home. Like, yeah. No, especially how shiny they are. They look like they final touches. No, I don't think so. Oh, that's it.
That's it.
These are good videos.
Fascinating. It's like the odd side of TikTok.
Yeah.
Yeah.
You
Yeah,
gentlemen keep shopping on TikTok for good videos.
Can you
Is
imagine
it
the algorithms
Is it
now?
Luther? Oh no, you amazing.
Teamwork.
I love this tag team. Yeah. It's
Makes-
Tom and Tom behind the camera.
Mm-hmm.
Yeah.
Tom.
Top. The tomboys.
The tomboys. Well, thank you for joining us. And these were some fascinating videos. We hope you enjoyed them as much as we did. And I hope you get some sleep. None of this gives you nightmares.
Bye.
Check you next time.